I've learned there are a whole set of questions that patients want to know about weight loss after bariatric surgery, but often they're afraid to ask. The questions that come up before surgery happens, when a patient's still in the process of choosing surgery or planning surgery, are questions along the lines of, how much weight am I likely to lose? What impact is that going to have on my health? Is all that worth it? And after surgery, the questions come up very naturally. Am I on track? Am I doing a good job? Am I going to fail again? Because most people have had the experience of losing some weight and then the weight comes back at a later time. So my name is John Pilcher. I'm a bariatric surgeon in San Antonio, and I'm going to try to give you some practical information to answer some of these questions and hopefully some more as well. Any discussion about bariatric surgery weight loss has to start by clarifying the concept of ideal body weight. And I'm actually going to mention this mostly to set it aside. It is not our goal to get you down to ideal body weight. That might sound strange because you've probably all been in medical weight loss programs that have set your ideal body weight as the goal at the end of the program. And it's true that ideal body weight is the level at which people live the longest if they grow up into that weight. That's actually statistically been proven. That's where the actual numbers come from in terms of ideal body weight. But what we've learned over a long period of time, and this is universal among bariatric surgeons, is that to lose from your excess weight, your metabolic obesity, your morbid obese weight, all the way down to this reference point of ideal body weight, it's too much weight loss. That's not going to be our goal. And so when we talk about the goal of the weight loss, we're going to use some different terms. We're going to talk about what's your best weight. What's the weight at which you're the healthiest and you have the best energy, in which you have a good appearance. What's the weight that's going to be your best weight in terms of the best health benefits and not too low. I also like to call this the fairy godmother weight. What if I had a magic wand and I could just, ding, make you be the weight that you want to be? That's a useful discussion to think about. So let's start there. What would you love to be if you could do anything? Some people will pick the ideal body weight, and if they do, then I'm going to tell them that my fairy godmother weight, or my best weight goal for you, is the ideal body weight plus 20 pounds or so, 15 or 20 pounds. And if we talk about this in terms of body mass index, you know that the vast majority of people who are coming into surgery have a body mass index of greater than 35, greater than 40, and often up into the 60s and the 70s. And I will tell you that the ideal body weight has a body mass index in the range of 22 to 25. But again, that low body mass index, 22 to 25, is not our goal. We are really happy if we get people down to a body mass index of 27 to 29. Now, realistically, is everyone going to get down to their best weight or their fairy godmother weight or this body mass index 27 to 29? Probably not. And I'm going to try to give you some ideas as we sit here that you can use to apply to your own situation and get a feel for where you are likely to go or where you should go with the help of your bariatric surgery. Now, as I talk about bariatric surgery in this video, I'm referring to sleeve and gastric bypass. These operations have very similar weight loss and a very similar weight loss pace. I'm not talking about gastric banding, which has less weight loss and which is really not done anymore. In my opinion, should not be done. And I'm also not talking about duodenal switch, which loses more body weight and has a different set of health outcomes than the gastric bypass and the sleeve. So just understand this is about gastric bypass and sleeve and some practical guidelines about weight loss. You might be wondering why there's a mismatch between the ideal body weight and what I'm calling the best weight, or the fairy godmother weight, which is a little bit higher than ideal. After all, ideal body weight means ideal body weight, right? And again, it is the weight at which people live the longest when they grow up into that weight. But when someone has been substantially overweight, even 50 pounds, but certainly if they're 200 pounds overweight, the body takes on some extra structure to carry that weight. And what I'm talking about is a little bit of extra bone, a little bit of extra heart muscle, a little bit of extra kidney, a little bit of extra liver, and all this adds up. And so that when a person is losing weight after being at 340 pounds, they are not able to shed all of that structure in a way that's healthy. And so in our experience, in the rare cases when people do get all the way down to ideal body weight after bariatric surgery, they feel a little bit tired and sick, and they look a little bit washed out. And that's very uncommon, but it is something that we've seen. And so it kind of reinforces for us that, yeah, the best weight, or the ideal forgive me, the best weight to get to is ideal body weight plus a little bit. And we are still going to use ideal body weight as a reference point mathematically, but just as a reference point and not as a goal for our patients to get down to. And if you're with me on this idea that our goal for you is to lose down to this number that we're going to agree on that's called the best weight, a bit heavier than ideal body weight, the next question that comes up naturally is, well, does everybody make it to the goal? And the answer is no, not everybody makes it to the goal. Everybody does lose substantial weight, and we can start giving you some ideas about what you are likely to lose by talking about your pre-existing characteristics. So with the sleeve and the gastric bypass, most patients lose about 70% of their excess weight. And excess weight is calculated using that reference point, not goal, but reference point, ideal body weight as a starting point. And people lose 70% plus or minus 10% at about 1 year from the surgery. Now, as you can imagine, there are several pre-existing factors that would impact on your success rate over or under that 70%. So a favorable factor is younger age. An unfavorable factor would be significant medical conditions, diabetes, bipolar disease, chronic back pain, anything else that's going to limit your mobility. A favorable factor would be having more muscle mass, so having kind of an athletic history in your personal history. And then there's lots of genetic variability. You've probably heard me say it elsewhere, but this obesity disease is not one obesity condition, but it's a variety of obesity conditions where the energy hormones are out of balance. And so the operations are going to have different natural impact for different people, and that part of it we're really not able to predict very well. Let's use this rule of thumb where a person's going to lose about 70% of their excess body weight at 1 year to work through some practical numerical examples. So if I meet a person in the clinic who has a height of 5 feet 6 inches, their ideal body weight is going to be about 140 pounds. So whether I meet this person at 240 pounds or 340 pounds, I am not trying to get them all the way down to 140 pounds. That's too skinny. We are using ideal body weight as a reference point, but not as a goal. So for someone with a height of 5 feet 6, an ideal body weight of 140, I'd like to see them get to 160, 165 or something like that. Now let's work through what happens if a person shows up at 240 pounds. So here's the math. At 240 pounds, their excess weight over the ideal weight is a nice even 100 pounds. I picked this to make my math easy. And if I say that they're going to lose about 70% of their excess weight, 70% of 100 pounds is 70 pounds. And so at 1 year, this person who started at 240 pounds might expect to end up at 170 pounds. That's pretty good. Are they at their best weight? Are they at the fairy godmother weight? Almost. I think that 170 is something we would all be very happy with because that's a sustainable weight. That person's going to feel good. They're going to be on much less medicine. It should be a sustainable weight for many decades. And they're going to shop in the normal clothes section. Isn't that cool? And that 170 pound weight is comfortably under the 200 pound threshold. And it's also not too skinny. It's not down in the 145 or 150 range where that person might not feel good. Now let's take my different example. What if a patient shows up at 340 pounds, not 240, and so that individual's excess weight is 200 pounds. That's 340 minus the ideal body weight 140 gives us 200 pounds of excess. And here again, if we say that that person might lose approximately 70% of their excess, they may lose approximately 140 pounds at 1 year after the surgery. Starting at 340, they end up at 200 at 1 year after the surgery. And that's actually a little distance away from the best weight or the fairy godmother weight, isn't it? But are we disappointed? I would say we're not disappointed because here again, this person started at 340 pounds. And now at 200, they're going to feel fantastic and they're going to look surprisingly well, and they too can shop in the normal clothes section. So in this quick little math exercise, you can see that when a person starts at a heavier weight, they lose more total pounds, but they don't lose down to as close to their fairy godmother weight or their best weight in comparison to a person who starts at a lower weight. And so one important side note that I'd like to make is that there are advantages to accomplishing the definitive intervention, that's the bariatric surgery, at an earlier stage of the disease process. Earlier meaning not as heavy, not as sick, and at a younger age. Now that I've given you some working knowledge to make a reasonable estimate about where you probably can go with bariatric surgery, we're going to shift and talk about, now you've had surgery, how do you check and see if you're on track, or what would you expect the actual shape of your weight loss to look like? Is there any way of benchmarking before you get to that 1 year and find out if you're successful or not? And the answer is yes, absolutely. We can make some predictions during the mid-course of the weight loss. Now, first of all, observe in this weight loss curve that the weight loss happens the fastest for the first 3 months. It happens pretty steadily and pretty quickly during the 3 to 6 month time frame, and then it tends to continue for another 6 months up until about 1 year. But the last 6 months, or the second 6 months, tends to be fits and starts, or what we call plateaus, where the weight loss will stop for a little while, and then suddenly the weight will drop, and then it'll stop, and then it'll drop, and then on balance people tend to settle out at about 1 year. Then it's very common for people to gain back 10 or 15 pounds between year 1 and year 2, and the majority of patients stay stable for decades after that, especially the ones that continue to follow up with us so we can keep coaching. The first key landmark on this weight loss curve is at the 3-month point. And there's a useful rule of thumb where at 3 months, a patient after sleeve or gastric bypass will have lost about half of what they are going to lose. So let me rephrase that. Starting from the weight just before surgery, not when they very first met us, but the weight just before surgery, to the 3-month point, whatever amount of weight the person loses in that 3 months, they can reasonably expect to lose that amount of weight again over the next 9 months. So if we apply that to our earlier examples, let's start with our 240-pound patient with the ideal body weight of 140 pounds, and we said that we would roughly expect that person to lose 70 pounds. If they are on track, then at their 3-month appointment, they'll be about 35 pounds down from their pre-op appointment, and they can expect to lose down, remember, to that estimated target weight of about 170 pounds. Shouldn't even say estimated target weight, to the estimated weight of 170, which is slightly above the best weight or the fairy godmother weight. If we have our 340-pound patient, we again would expect them to lose around 140 pounds because they're 200 pounds overweight. And we can say that probably they would lose about 70 pounds in the first 3 months if they're on track, and then lose another 70 pounds over the next 9 months. Okay, and so in our practice, patients are going to have an appointment with the medical team at 3 months, and it's very useful to use that 3-month visit as a conscious discussion point to see if we're on track or not. And as a patient, you can come into that visit with an idea about whether you're happy with your ending weight or not. And in our practice, most patients are on track to end up at a weight that everybody's going to be very happy with. Rarely patients are on track to be too low, and I'm not going to go into that extensively, but just suffice it to say that we have plans in that case. That's not the topic of this video. And then maybe 1/3 of our patients are going to come in above a weight that we're happy with. And I should say this is a discussion between the patient and us as a surgical team and the medical team. But about 1/3 of the time, we agree that we're not happy with the goal. Happy with the estimate about where you're going. And this may be from that 340-pound patient who has a very reasonable expectation of getting down to 200, and that would be fine, and that would be fully successful, but it would be nice to lose down to 180, right? And so we're going to use that opportunity with that patient to intervene and intensify the therapy to try to get the weight down to 180, even though that would be better than the usual 70% percentage. There may be another small subset of patients who are not on track to lose that estimated 70% of weight. Maybe they're on track to lose half of their excess weight. And if they're happy with that endpoint, that's actually okay. But very often, if they're not on track to lose the 70% excess, then the patient and the medical team and the surgical team are going to agree, well, let's try to get that weight loss coming down. And the key thing is, if we're looking at this at 3 months when a person is still losing weight, and if we can intervene to alter the trajectory of the weight loss, that is much easier and much more effective than getting to the lower weight a year out from the surgery and finding out, listen, I'd like to lose 20 or 30 more pounds. That's really hard. So it's much more effective to be proactive, and this is what we're going to try to do, to be proactive at the 3 months, and if we're not seeing a favorable trajectory, then we want to alter that trajectory and get the weight loss to come down more quickly. Now, what does it mean to intensify the medical therapy? First of all, the medical team is going to work with that individual patient to make sure that the lifestyle changes are working as well as they can. Basically, 3 categories of lifestyle change: the right food plan, the right exercise plan, and making sure they're taking their vitamins, and also that the vitamins are actually working in their body. Okay, those are the core principles, and then once those core lifestyle principles are in place and as good as they possibly can be, doesn't have to be perfect, but once they're as good as they possibly can be, then the medical team has the option and the ability to add in some pharmacologic treatment or medicines to help the surgery work better, or to boost or to turbocharge the surgery while you're still losing weight. And we've moved beyond kind of the old-fashioned idea, which was people would either have surgery or medical treatment, and now what we want to do is have integrated treatment, whatever's going to be in the best service of your health in a way that should be sustainable and lasting over time. So once again, 3-month visit, think about where you are, think about where you're going, and if you're not happy with that, then we're going to be ready to have a good discussion with you about what can we do differently. So far, this video could give a reasonable person the idea that weight loss and numerical weight goals are the key goals of the bariatric operation. And it's useful to track weight loss, but of course our key goal for our patients is to achieve lasting, sustainable health improvement. We're going to talk about how to measure some of those non-numerical goals, or how to get a handle on some of those goals, and talk about how it actually can be counterproductive to try too hard to reach a difficult or an uncomfortable or an unsustainable numerical weight loss goal. Many of these non-numerical health improvements are going to be obvious to you. You're probably going to have more energy. You'll move more in a way that feels natural to you. You'll be more active. You'll have less pain. You'll have better breathing. You'll need fewer prescription medicines. And like I mentioned already, you'll be able to shop in the normal clothing section. One other feature of the health improvement, or one thing that leads to substantial health improvement, is the reduction or burning away of the internal fat that we call visceral fat. This is the stressful, damaging fat that infiltrates into your vital organs inside: the heart, the kidneys, the liver. This is the fat that makes the belly tend to be really tight and round for some people before surgery. And there are fancy tools that can be used to measure this visceral fat, but you can get a pretty good idea about the visceral fat level by looking at your own body in this area here. Interestingly, the neck and the upper chest turn out to be a pretty accurate window to the level of internal or visceral fat. So once we can see your neck muscles, once we can see your collarbones, that's a pretty reliable indicator that your visceral fat is down to a minimal healthy level and that you've already achieved your weight loss goals. In fact, this often shows up at 4 months or 6 months out from the surgery, and so it's very common that I'll see someone at their 6-month visit and say, guess what, you're healthy today. But yes, you'll still lose some more weight, and that's great. That's kind of like creating yourself a safety margin away from that previous unhealthy, elevated weight. Now, on the other hand, it's almost impossible to lose all of the outside fat, and I'm talking about that kind of spare tire fat, or the fat that you'll find on your arms, or on your legs. And yes, it's loose skin, but the loose skin naturally has some fat underneath it. And no matter how skinny you get, even if you become malnourished and underweight, you're still going to have some floppy skin. So if that skin bothers you, and this is not to tell you what you need to do, that's where plastic surgery comes in. And we know people. For plastic surgery, just as a quick little digression, we don't like people to actually go into plastic surgery until about 18 months after their bariatric operation, for a couple of reasons. One is because we want your body to recover, but also because the skin shrinkage is very slow and gradual over about 18 months. But having said that, it can be pretty reasonable to meet with the plastic surgeons at 6 or 9 months out from the surgery, because at that stage you can already tell if the skin is going to be bothersome enough to go through that additional stress and pain and recovery and financial aspect of the plastic surgery skin removal. And one other last note on plastic surgery is that unfortunately it's pretty rarely covered by insurance. And so to meet with the plastic surgeon well before you actually plan surgery gives you a chance to get the finances into place. During your second 6 months after surgery, from that 6-month to 1-year time frame, you're going to be transitioning from a time of surgical recovery and rapid weight loss into a time of more gradual weight loss. And what I hope is going to be your focus is building lifetime habits. And I think the lifetime habits are going to be very important. because your amount of weight loss up until that point, even up until a year out from surgery, is largely dependent on the factors that you brought into the surgery, talking about your age, your genetics, your athleticism, your pre-existing medical conditions, and your genetics. 80% or so related to pre-existing factors. In the long run, 5 years, 20 years down the road, most of your success rate and your health improvement sustainability is going to come from the habits that you use to work with the surgery. In other words, the impact or the strength of the surgery or the potency of the surgery is going to naturally fade a little bit. It's never gone, but how you work with the surgery and use it as a tool is going to be the main beneficial factor for you going forward. So along these lines, I want to give you a recommendation about your approach to your weight level. At about a year, as we've mentioned, you're going to settle into some certain weight. And whether you're happy with that weight or not, I'm going to recommend that at that level, mentally, you adjust your habits to a sustainable way of maintaining your health improvement and cherishing your health improvement rather than doing intense, unsustainable interventions to lose that extra 20 or 30 pounds. Why would it be bad to try to lose 20 or 30 more pounds? That doesn't sound bad. It's the intense, unsustainable part is the part that would concern me and that I've seen for patients over time. So you're probably familiar with the concept that episodes of weight loss and weight gain or episodes of diet starvation lead to upregulation of the body's set point and net lead to weight gain over time. I think that happens after bariatric surgery as well as it can happen before bariatric surgery. Exercise is awesome, and I love strength exercise, but overly intense exercise, if it leads to injury, will lead to less exercise and less physical activity in the long run. So here again, I want you thinking about sustainability rather than exceedingly intense. And again, I want you to where you settle at 1 year, I want you to think about working on maintenance of that and avoiding regain more so than trying to lose 20 or 30 more pounds. And we as a team will work with you on that as well. Regardless, the amount of weight that you'll lose at 1 year is going to be huge. Your weight loss benefits will be amazing. We will work with you on making those benefits sustainable for the rest of your life. Thanks for sharing your journey with us.